Amid attacks and accusations of chaos and incompetence, British Prime Minister Boris Johnson has set out an agenda for the G7 meet on July the 11th, with a top focus on dealing with COVID-19 pandemic. Boris Johnson has outlined the importance of getting each and every one inoculated to speed up the fight against the coronavirus. He wants the G7 group of rich nations to agree on a plan that would see everyone around the world vaccinated against COVID-19 by the end of 2022. He has added that it's crucial that developing countries receive vaccine supplies as quickly as possible.
And what we want the G7 to try to agree is that instead of vaccinating the whole world by 2024 or 2025, which is the current, what we'd achieve on the current timetable, we need to get this done by the end of next year, by 2022.
He has stressed on the need for a global treaty on pandemic preparedness. He said, and I quote, "We need to have rules so that there can be no interruptions of supplies across borders so that we have secure supply chains for the things that we depend on in future." British Prime Minister Boris Johnson wants the upcoming Group of 7 summit to reach an agreement on COVID-19 vaccine passports. This also includes COVID certification.
We've got to make sure that fighting the next pandemic is also a global enterprise. And that means when it comes to things like vaccine passports, which you particularly raise, that we have the same protocols and the same understanding about what works and what doesn't work. If you remember, we've all been, for the last year, everybody's been setting different standards, different approaches for quarantine, for lockdowns.
The move comes as many European countries are working to introduce a vaccine travel document and introduce of certificates at the national level. The United States has also been taking a very close look at the vaccine passport. Meanwhile, the United Kingdom is mulling to make COVID-19 vaccination compulsory for healthcare workers. The move is in the backdrop of the spreading of new variants and increasing numbers of infections in hospitals particularly.